"We are going to see a lot of people unable to go back to work soon," said Tom Kochan, a professor at the MIT Sloan School of Management. "Hospitality, retail, travel, restaurants, they are going to continue to be hit very hard by this. For that reason," Kochan said, "the federal government should provide additional aid, such as extended unemployment benefits and more economic stimulus." Massachusetts ranks among the states hardest hit by COVID-19, and it is one of the last to reopen its economy. Nearly 1.1 million people in the Commonwealth have applied for unemployment pay in the past 8 weeks. That's nearly 29% of the pre-pandemic labor force. Nationally, the jobless rate is approaching 20%, the highest since the Great Depression, and the economy will shrink by 6% this year, according to the International Monetary Fund. The U.S. economy, as measured by gross domestic product, fell 4.3% during the Great Recession of 2007 to 2009, while unemployment peaked at 10%, according to the Federal Reserve. It took more than 4 years for the job market to fully recover. "We're going to be digging out of a very deep hole," said Mark Zandi, chief economist at Moody's Analytics. "It's going to be a long time until we're fully out." Still, Zandi and other economists expect workers to begin returning to their jobs in significant numbers as the state moves through the 4 phases of Baker's reopening regimen. Construction and manufacturing, which shed more than 100,000 jobs combined in the past 2 months, even though the sectors remained partially open, got the green light Monday to ramp up to full capacity. Hair salon owners and pet groomers, car washes, lab and office space workers, and retailers with curbside pickup will get their turn next Monday. Managers at Therapedic of New England were completing plans to bring back about 60 factory workers to the Brockton mattress maker this week. According to partner Mark Savel, Therapedic has been buying masks, gloves, plexiglass, and other supplies to comply with any new state hygiene and social distancing measures. Savel, whose mattresses are sold at retailers such as Jordan's Furniture and Circle Furniture, expects pent-up demand at first, but then business will soften. He said some of the key factors that trigger sales are being upended by the virus, such as weddings, students moving into dorms, and house guests. "It's going to be a slow burn," Savel said. "I don't think I will see a real kick in the business until the end of the 4th quarter or the 1st quarter. The pace of restarting will be slower for many other industries. Health care and human services providers, which have also laid off about 100,000 employees, can begin high-priority preventative care, pediatric care, and treatment for high-risk patients and conditions now, but will have to wait for Phase 2, which will start no earlier than June 8, to resume less urgent preventative care and day programs."